Okay. So thank you very much for joining us on this first episode of our webinar series, just a discussion around African diaspora researchers in just trying to explore what your journey has been like and trying to find ways to encourage, more researchers of African origin who are in diaspora to get in the field, try to improve their knowledge, contribute to the knowledge base, and of course also impact the continent as a whole. I am Folake Lawal. I am the executive director at Amal Outreach. We're a nonprofit organization that is focused on community development with a specific focus on healthcare, and research in healthcare is one of our strategic objectives. So thank you very much for joining us again. So I will hand over to you and just ask you to introduce yourself and let us know your current position and role.
Okay, thank you. My name is Ibrahim Abioye, and I am a physician, and I trained in Lagos and in Boston. And I currently am a medical director at Genentech, which is a pharmaceutical company in California. But I also wear a number of other hats. I have an adjunct research role at Harvard. I continue to do research in developing countries, principally in Tanzania. I have some ongoing research work from prior years that I still haven't wrapped up. But I also help lead Stats Clinic, which is a nonprofit that teaches research method, statistics, and epidemiology to researchers and aspiring researchers, mostly with the healthcare focus in developing countries. So we have a large following across most of Africa, with the largest cohort being from Nigeria. But yeah, that's who I am. That's what I'm currently doing.
All right, thank you for that. So would you be kind enough to share with us your inspiration to extend your research to African countries? I know obviously you're from Nigeria, you initially trained there, but what was the inspiration such that your advanced training and research that you did there that made you decide to do it in African countries and continue there? And what has the journey so far been like?
Yeah, so I think the first inspiration really is what you had mentioned. I am Nigerian. I trained in Nigeria, and I continue to have family there. It's certainly an issue of, if this doesn't get fixed, right, everyone's going to be affected in many different ways. So that's one. But there's also the fact that there are research opportunities that, there's still a lot of opportunities in developing countries that are untapped, that are unmet, and so that's another inspiration, so to speak, for why I continue to focus my research as often as I can, on developing countries. So the first is that I'm from there. The second is the opportunities, and the third is just potential impact, right? If you think about the fact that when you're dealing with low resource countries, the little that you're able to contribute means a lot, and so that's the reasons why I think it's important to continue to engage as much as possible with developing countries, with research in Nigeria and elsewhere.
Thank you for that. I tell a few people, depending on the conversation, that people in diaspora, many of us, we left Nigeria for, very varying reasons, but really it is to better ourselves and to be able to give back. Just like you said, we've been immersed in the problem, we grew up in it, and we know that things can be better, and just being able to be equipped to tackle the problem in another way. So there's a phrase I say, which is like, only those who know better can do better. So I guess that probably fits into your inspiration. Now, yeah. Now to go into funding, because I know that is something that it's kind of like a limited pie, sort of. And, Africa is not really a stakeholder or does not have a lot of ownership of that pie. We're more recipients. So it's the person who owns it that decides how things are distributed. So how did you or do you continue to access funding? And how do you connect with collaborators, both outside the continent and in the continent?
Yeah, thank you. So funding is probably the most simple, the greatest challenge as far as health research is concerned, in African countries. And like you mentioned, that because a lot of the funding comes from abroad, and so the research agenda is often set from institutions like NIH. And so there are two approaches that one has to take. One is to align with the research agenda, and the other is to adopt approaches that allow you to work outside of that research agenda. And to different extents, I kind of adopt both approaches. So first of all is aligning with the research agenda. So a lot of my previous research while I was a PhD student at Harvard, and some of the work I continue to do with Harvard colleagues, is research that's funded through the NIH, right? So that requires aligning with the research agenda that the NIH has set, and continue to write grants that align with that research agenda, and so that's one aspect. It's a very competitive process, because imagine that you're competing with researchers from all over the world, and but it's really essential that it helps to also sharpen your research skills, your writing skills, your ability to advance research ideas in clear and meaningful ways. It helps you to refine the questions that you're asking. So that's one issue that's aligning with the research agenda. But the second aspect is working outside of it. So there's a number of ways that I work outside of it. One is that so for instance, it's a lot of research ideas that don't need a lot of money to fund. So systematic reviews, they'll probably take your blood, your sweat, but but they can be opportunities to do high impact work. So systematic reviews, meta-analysis, what you need to be able to do this is time and dedication. So that's one piece of work, and I have a number of papers that have been thematic reviews and meta-analysis. I think that they might maybe 25% of my entire research portfolio. So that's one. Then two is collaborating with people who already have funding. And some of that it comes from referrals and networks. People reach out to you for your skill sets, or they need you to contribute in one way or another, and then people reach out to you. So that's the second aspect, where, so for instance, I'm currently working as a statistician on 3 trials that are funded by the Gates Foundation. But essentially, it was a research group at Idiaraba that have already gotten the funding for this project, and they need someone who can bring research expertise, statistics expertise, so to speak, and then they reach out to me. So that's another way. So basically, expanding your network is another way where people can reach out to you for ideas that are already funded. But I think there's a third aspect that a lot of people are not tapping into, and that is projects that people are self-funding, right? So because of the nature of the educational system in Nigeria, where trained, a lot of the research projects that people do for their dissertations, for their master's thesis, are self-funded, right? A lot of people just do a piece of shabby work to just go through and move on. But the reality is that you spent all the money, you're still going to do work. Why not do it as rigorously as you can? Collaborate with others and do work that can be rigorous, can be published, can be high impact. This is, I think, one area that a lot of people are not tapping into. So, for instance, I have helped people look at their thesis work, their dissertation, and some of these have gone on to be published. And that's a pipeline of work that I think is really useful. There are hundreds of thousands of such research projects that are published every year in our universities. That opportunity, basically. So I have answered a number of questions here, brought my experience to play. How have I been funding, or how have I been accessing funding, so to speak, for my research? But also, I have also posed, I would say, examples and potential suggestions for how people can go about it, leveraging my own experience.
Yeah, thank you. That was a very extensive answer. And, in terms of MSc and PhD projects, it's something that our organization is also hoping to tap into, to find universities that have students that want to do public health projects, and we can collaborate with them as real life case studies, and also as we grow, to be able to use our own population data to analyze and generate information that we can add to the fund of knowledge for improvement. So that's awesome. Thank you for mentioning that. I want to
Sorry, before you move on to the next, because I know you're going to move on to the next question, I wanted to quickly plug that although a lot of developing countries are not funding research, there are still funding opportunities.
Mm-hmm.
So, for instance, the Nigerian government funds some research, and they have competitive processes for funding and research. It's a small slice, but within the university system, people are able to access that research funding. So that's certainly something that a lot of people are not paying attention to, but could be another stream of funding, that's acceptable. The third, another potential approach for funding research is private organizations, companies, right? So some companies fund research. So pharmaceutical companies, for instance, fund research that aligns with their strategies, with their priorities. So that's another approach that I think is yet on tap, but might be able to be something that people explore.
Thank you for that additional information. I wanted to quickly piggyback on a question or something you mentioned, to just extract a question from there. It's about set research agendas, especially, that's coming from the global north. But do you think that these research agendas really address the core gaps of research knowledge in African populations? There are things, that do make sense. You talk about anemia, maternal mortality, infant mortality, a lot of these. But do you think that either some of the questions that are asked or the way the answer is being sought after, do you think that they address the gaps in knowledge and the problems that African populations are facing?
I think not completely, to be honest. There are certainly opportunities for improving the way that research questions are identified and the kind of research questions that are asked, that are explored and funded. It's the current situation that we have, and I take the NIH, for example, because that's the one that I've engaged with the most, where the NIH sometimes determines research questions based probably on what their staff believe are priorities, or sometimes based on, they have some calls where they ask researchers to tell them what they think is important, and a lot of people do not participate in those calls. So that means that you don't get an opportunity to impact the process of seeking ideas. You don't get an opportunity of impact the kind of ideas that the NIH is going to fund, right? Those are the some of the issues. But I think the other thing is just the timeline, right? So if you're applying to an NIH grant today, it might take 6-7 months, maybe a year before that grant can be funded and then you can start your project. That means that if there are like rapid research ideas that you want to explore, you cannot use that kind of funding for it, right? So if there are opportunities to demonstrate something based on the program, you can't use that research idea for it. That's another challenge with where the research agenda that the global north is setting is not always the kind of things that you will be doing if you are funding locally and you have like complete control over what kind of topics to explore.
Thank you for that. So what are the kind of solutions you think? Because I feel like from what you've mentioned, representation, diversity, equity, inclusion, all of that, is one way, but it depends on who's looking at it. And if it's even realized that we need to make room and deliberately call for outside or African voices because we're trying to solve their problems. But what do you think that's the solution to having our voices included adequately in these calls or in these write-ups? What do you think that could look like?
I think that, to be honest, if you don't engage with a process, it's very hard to get the benefits of it. And if we have a scenario where a lot of us are not engaging, it's hard to ask for a chair seat at the table, right? So if we have a scenario where we're not engaging with the calls are made, we're not responding to them. Those calls, it's extra work on top of, you might need to send in like a 1-page. And there is no assurance that it's going to determine exactly what research questions are asked, right? So there is a little bit of prioritization that people are doing. Should I be spending my time doing this, or should I be spending my time on my other paper that's going to be published? So it's some balance that we have to strike there. So that's one, to engage more with the NIH process. The second one, I would say, is for us to, the second one I would say is for us to, apart from engaging more with the research process, will be for us to ourselves think critically about the research questions that we're addressing, right? There are often ways where there's a research question that the NIH is interested in, but you then match that with the research questions that you think are critical and make sure that there's some alignment in some ways in the ways that you're asking. There's often opportunities for like exploratory research that leverages work that's already being funded, right? So that's another approach that I think is not being tapped into enough. So you have all this data that's sitting there. So if you think about all the research that the NIH has funded in Africa, there's for many in many settings, there's data that's sitting there, and there isn't much that's being done to pick up that research or pick up the data and write exploratory work on spaces. Then there's collaboration, right? So sometimes the people who are interested in the research are in another country, who have data in another country or in another institution, and we need an opportunity to be able to interact with ourselves to ensure that the research questions that are critical, that resources exist for outside of our setting, they're able to tap into it in some way. Those are some of the ways I feel like this is not necessarily the most aggressive set of suggestions, right? And there are potentially other things that we might say, maybe picket the NIH, for instance, or engage with Bill Gates Foundation and tell them about these challenges. Certainly, those are approaches that could work, but I imagine that as an individual researcher, you're probably focused on what can I do today that can advance my research in the next couple of days, that can be approaches to contribute. And so that's why I've suggested these approaches.
Yeah. Thank you for that. So what I hear is that, there can be individual efforts, but it does take some work, and but that individual effort kind of still has to go with the flow. You still have to work hard, take the time to engage with the process. If anything extra or out of the normal process is going to be done, it's going to take additional higher level, I would say, maybe governments, governmental organizations, government research bodies that, raise a call, raise a voice, and, bring that to the forefront, call for collaborations, and try to work on creating a change in a way. So, well, we'll see how that resonates with, those people in those positions. Now, in terms of the gaps, what do you think, or what have you seen that are the gaps between research that is being conducted in Africa, either by Africans in Africa or Africans in diaspora, but that's being done in Africa, versus research that's conducted in other parts of the world, especially the global north?
So I think two issues quickly come to mind. And one is the methods, and two is the access. So let me talk about methods. So a lot of research that's published in African countries, right? If you say maybe I could hazard the guess of maybe like 50% of them use methods that do not adequately utilize the data to make inferences that are so for instance, an example in epidemiology would be confounding, right? A lot of the research that one comes across, the research methods are not adequately addressing confounding, are not adequately addressing bias, like potential sources of bias that are often obvious to the trained eye. There's a lot of dependence on contextual studies to make inferences that could be potentially causal, So and these are challenges that just improved training will address, improved peer review methods, or, strengthened peer review would address better improved training. Those are, and they're not easy, because it's essentially, you're going to have to train like a generation of researchers who then trains the next generation, so to speak. So that's one. But the second thing is access. So even for the studies that are well done, they often end up in journals that do not, they are not accessible around the world, that are not available online, that are not easily searchable from Google Scholar, which is where so many of us go when we're looking for papers. They're not available on PubMed, on Embase, and so you end up with research that's locked away, doesn't get cited. And if it doesn't get cited, then no one knows about it. No one is using it for policy, which I think is the other gap, is that the distance between the research and the policy outcome is so far away. And that makes it hard to make a case for increasing the funding of research. It makes it hard to incentivize, researchers to do even better research, right? So when you think about all of those, that kind of chain, we improve the methodology, the learning of the methods. We also need to tighten. We still need to make the research more available, but we also need to tighten the gap between research and policy. And all of these are kind of linked together in some way. Another reason why I think we need to improve the learning of the methods is that there are so many people who engage with research, right? Or who should engage with research but don't. So a lot of doctors who, every time they hear a p-value, they get scared, right? So And that's so many people, a lot of health workers are in that group. If those people have a stronger methodology training, then they will at least be able to adapt the method, the papers, what the reading papers to their practice earlier. They will be able to make a case for interventions that make more sense. But then also you would have a larger group of people who are doing good, rigorous work, you know, um, and then you can then, so it's kind of like you have that chain. But then there's the access aspect of it, and the number of tricks um, that I think that one can implement as an individual to get around the challenges of open access and getting their research funded, getting their research online, in addition to the work that a lot of people are doing online, advocating for improvements in the way that research is published.
Thank you very much for that. Definitely, I agree. I mean, I agree with all your points, but the part about translating research into policy is one thing definitely I know that is really, really lacking. A lot of work is done, a lot of data is collected. Many countries don't even know the data they have. They don't know the information they have, and many people sitting at this desk don't know how this information translates to whatever it is they're trying to achieve. And in the world now where everything is data driven, we really should work to connect the dots and connect them efficiently. So thank you for bringing that up. Now, personally, on your journey, what are the challenges that you've encountered, in whatever sphere? What are the challenges that you faced?
So I think that as far as challenges are concerned, they have varied depending on the stage of life, so to speak. So in the beginning, I've always been interested in research. I think in medical school, and when I finished medical school and was in my house job, I was doing research work on the side. And in thinking about the analysis for some of the research, I quickly identified that there were gaps in my training, so I think I wanted to do like logistic regression. I thought that would be appropriate here, and it was just for confounders. I didn't know how to do it, and it was really hard to find someone who could teach you. And this was before the days of YouTube, where you can just go online and all the information is there. So that continues to be a challenge that a lot of people experience even today, right? Where there aren't people around you who can easily teach you the methods that you want. And oftentimes you need you need some degree of preparation to be able to engage with the materials online. So that's one. Two is funding. We've talked about funding, and funding is always an issue. You often have to jettison research ideas that you want to do because they're expensive and you don't have the money for it. You and this is the reality for everybody. This is the reality for the most senior Harvard professors that I've worked with, as well as the newest people on the block. So there we can't do everything that we want to do, but hopefully we can do more, much more than what we currently do. Um, so funding is the other thing, but I think that at the moment, one of the things that I have had to engage with, and when I mean at the moment, I mean in the last couple of years, has been how do I strike a balance between my need to do research versus my need to get well remunerated for it. And this is an issue that many people are finishing PhDs and are realizing that either there aren't as many opportunities for them to get like faculty roles, or those faculty roles are not as well paid as they would like. So that's something that I've had to think about very critically in the last couple of years, and that's why I currently have the kind of career that I have now, where I am working in a global pharma company but also spending whatever time I can on the side, my weekends, doing all these other research endeavors that I'm interested in, which if was well paid, I will do full time. That's what I mean. But it's not as well paid. So that's a challenge as far as my own personal journey is concerned. I'm sure a lot of people have similar stories that they are addressing in many other different ways, but yeah.
Yeah, thank you very much. That honestly raises a huge concern, which is remuneration for individuals, because we're human and we're adults and we have things to do. So, and it sheds a light on really how I don't want to say how researchers are valued, because even though the monetary value is not it's not only the way you show people appreciation or value, but when people cannot economically, when it's not economically meeting their needs, then I would say the appreciation is not enough. So that's something that needs to change. And I guess, having research funding from multiple sources is something that needs to be done. And so thank you very much for that. We're moving close to the end. I think I have two more questions.
Okay.
And the next one is that what are the opportunities that you see available for upcoming researchers to explore? Especially, those who are African origin in diaspora, but those who are also home, either they're looking to stay on the continent or they are looking to move out of the continent for good or for capacity development and return. What are the opportunities that you see for them to explore in research?
So I think that the term opportunities is a loaded one in the sense that it can go in like many different directions. So for instance, research opportunities to address certain research questions, and there is quite a lot depending on what resources the person might have, whether they have time, but I think that one issue that I'm just going to talk about research opportunities very broadly. One issue that is not necessarily an issue in developed countries is the question of like descriptive work. So how often is X happening? How often is Y happening? How often are people having severe malaria, in children emergency in Lagos? How often are, simple questions that are not necessarily relating to whether one thing leads to another. This is what I mean. This kind of descriptive work is a huge opportunity in developing countries of Africa. And a lot of people are not looking at that opportunity and are not doing enough to address it. You need simple design to do it, but you need to do it properly. It still has to be rigorous, So that's one huge opportunity that I see, in addition to a lot of what people are addressing, which are like analytical, where you're looking at to what extent X leads to Y. I think that if people can do more thoughtful descriptive work, descriptive work actually has a greater amount of impact on policy than analytical work, and I don't think that people realize it as much as they should. So that's one as far as what kind of research opportunities exist. But the other thing is in terms of career opportunities, how should one direct their careers? I will say that people should think carefully about collaborations, like reach out to colleagues, reach out to senior colleagues who who you might know of, and ask them about opportunities to collaborate. I fear that it doesn't happen enough in our setting where medical students are reaching out to their seniors, but it should, because oftentimes the seniors are sitting on resources that they cannot apply. but they don't know how to. There is a mismatch, so that's one. There, there are also opportunities abroad, so to speak, right? So fellowships that people can explore. There's often fellowships that allow you to learn, that maybe help you to integrate in an MPH program for a year. Fellowships that help you to, embed yourself in a research group and just see how it works. Maybe spend some time for a year, do some research. Um, there's also fellowships that just give you access. So for instance, there are these fellowships that help you spend maybe half a year some in one country, half a year in another country, and you can learn like how things work across the board. But apart from fellowships, I think that one of the things that I've come to find is that research programs, right? Research degree programs tend to deliver a lot of rigorous training that we underestimate its impact. So I used to be one person who always thought you don't need a PhD, right, to do research. But since I've gone through the PhD program and seen for myself firsthand how much my work has improved between the time when I went in and the time I came out, right? I've come to be someone who advocates that if you want to do research, a good idea is to do either to do a PhD program or, to work closely with people who have that skill set, so you can leverage that skill set in your work. It's not possible to know everything that you need to know, but if you work with people who can help you to fill those gaps, then it becomes critical. But again, I think the other thing that I want to say is collaboration. Just leading off from that, I talked about collaboration vertically from junior to senior, but there's also a lot of opportunities for interdisciplinary collaborations. And one gap, for instance, that I've found is that people who are outside of medicine and public health, for instance, tend to have their own experiences, their own skill sets that are useful in medicine or in public health, but we're not seeing it. So I'll take example, health insurance, right? So you have the actuarial sciences people who might be able to provide some insights from the work that they are doing outside of the public health sphere. You have people who are trained in statistics and maths, who can be able to help provide some of the gaps, help address some of the gaps in methods that are available. Sometimes the healthcare researcher has to teach them the subject matter up to a point where they can then converse, right? But the skills that they have, you cannot pick it up in a year. You see what I mean? Like, but and you might not even know what you're missing until you're saying something, and then somebody says, "Oh, but you cannot do it like that." That's the issue that I think there's not enough interdisciplinary collaboration in our setting, and that's a huge gap that I hope that we can be able to address. That's an opportunity by itself. I think those are some just examples. I know that there's probably a long list of opportunities that one can think about, but these are some ways that I've chosen to think about them.
Thank you very, very much for that extensive response. And, a number of it definitely does apply to us as an organization. One of the hopes I have for us as an organization, even though we're a nonprofit, is to be able to build our research base to the point where we can write for training grants, right, to be able to train people in research. And in bringing that into disciplinary, I actually do see a lot of use in anthropology research that we can use, because we're dealing, public health is human life, and many times us as either physicians or medical or health professionals, you always need other perspective and other points of view, and anthropology, sociology research helps to see, human behavior and human life in a slightly different way than medicine. And definitely, so I agree with you that being able to do an interdisciplinary thing is something that we definitely need to explore and grow so that we can have more cohesive and more wholesome research questions, processes, and outcomes. And when you mentioned descriptive, I smiled because it's interesting that descriptive research actually forms the basis for a lot of analytical questions, because it just pops up something that someone has never thought, and you're like, oh, wow, we really need to look at that. So descriptive is very important. Many times, yes, we don't, because they're like, the impact factor, all of that, but it serves as the basis. It helps you to highlight things, and multiple research can come out, multiple questions can come out of descriptive research. So thank you very much for those points. Finally, you may have answered this, but maybe you just, if you haven't, or if you have more points, you can just mention them. And it's that, what are the 3 things or areas that you think are crucial to improving our research capacity and output in African countries?
Yeah, I feel like I have mentioned it in passing.
Yes.
So one is methods. I talked about methods earlier. And I have a lot of interest in methods, in part because it's a gap that I identified for myself very early, and I still continue to identify. I come across some methods and I'm like, oh, I don't know how to do this one. But the question then is, do I know who can teach me? Do I need to learn it? How will I apply it? And then I use that to decide, should I be learning this? But definitely methods will help us with doing correct research, doing research correctly, and making sure that our research is competitive. Then once you have the right research methods, the second bit that I think a lot of people do not realize as far as research is concerned is writing. There isn't a lot of writing training for research. And that's a major challenge. A lot of people learn it on the job. In developed countries, there are often writing programs within strong research organizations, within like the top universities, right? And so that's maybe that's an opportunity for interdisciplinary collaborations. All these people who are in English language and all that, who can help the medical community, the public health community, scientific community improve their writing. So that's one way. But writing is certainly important. I think that there's also the publication. Writing also reflects in like grants, not just papers. But then there's also publication. I talked about that earlier, but I think that there's one other aspect that I want to highlight, and that is developing a research agenda. One of the issues that I find is that a lot of us jump from topic to topic without coherence. So when you look at the person's CV, you should be able to say, okay, this is the story they're trying to tell with their research lives. And we don't often find that to be the case. If you do some literature review, identify gaps, and then just define over the next 1 year, over the next 2, 3 years, 5 years, this is the space I want to play in. These are the research questions I want to answer. And then you can figure out, okay, how can I answer them? Where can I find funding for them? Do I need funding? Are there ways I can get around the funding gap? Are there people I can collaborate with to help us address this? And there are often occasions where you cannot fully address the gap just because certain missing pieces are just, you just cannot get it. Maybe you need $1 million for your research and you're not getting the funding, So that will be something that will be clear to you yourself that, okay, I have not been able to address this because of these limitations. But I think that having a research agenda helps you to see the full spectrum of research questions that surround the one that you're most interested in. And then you can address, so that you're not just doing one paper and moving on. It might be that around that one paper, there's like 5 more papers that you can do, that more fully address the question that you're interested in, that helps to tell a full story. That's something that I haven't seen enough, and young researchers should adopt as a more part of the process of their research, so to speak. I think that's going to be really useful.
Thank you very, very much for those answers. So, you've given us very exhaustive and reflective answers today, things that we can obviously, take back, work on, reflect on, and just see how, as individuals who are, just individuals working or in collaboration or as part of organizations, can definitely see how we can use that to make some change in our circles. Dr. Abioye, thank you very, very much for taking the time to join us today on our first episode of this research series. We do hope that we would have you probably on a panel next time, but for now, for this year, we have 3 more episodes. We have a total of 4 this year, and we hope to see you in our other episodes. So thank you very much for joining us, and we'll see you next time.
Thank you.
Thank you very much. Bye.